Now we'll move on to the official inauguration of today's program, Rehabcon 2025. For the inauguration, I'd like to invite on stage our guests of honor who have arrived. Professor Dr. Indrajit Saha sir, Director of Medical Education, Ministry of Health and Family Welfare, Government of West Bengal. Professor Dr. Manoj Banerjee sir, Principal, Arjikor Medical College and Hospital. Professor Dr. Shopon Misro sir, Head of the Department of Physical Medicine and Rehabilitation, Calcutta National Medical College and Hospital. Dr. Monu Mohan Vishwas sir, Senior Consultant Physiatrist, Bellevue Hospital. Dr. Shankar Prasad Sinha sir, Head of the Department Physical Medicine and Rehabilitation, Peerless Hospital. Dr. Moshumi ma'am, Associate Professor, Department of PMR, Calcutta National Medical College and Hospital. And finally, Dr. Kaustubh Chakraborty sir, Consultant Physiatrist, Peerless Hospital, Kolkata. I'd like to invite the dignitaries on stage for the inauguration of Rehabcon 2025. I'd like to request our Honorable DME sir, Professor Dr. Indrajit Saha sir, to say a few words.
Very good morning to you all, sirs and madams. Honorable Organizing President, Rehabcon 2025, Honorable Organizing Secretary, all the dignitaries sitting in the dais, all my respected seniors who are sitting in the audience, my humble respect to them, all the students and my colleagues. I congratulate the organizers for organizing this conference, for organizing this conclave under the name and style Rehabcon. To the knowledge of a layperson, physical medicine and rehabilitation or rehabilitation just focuses on how to let me reframe my sentence. It focuses on only the physical domain, only on the lifestyle changes, how to exercise, what to do and what not to do. But by the definition of rehabilitation, if we go by the age-old definition of rehabilitation, which was in our textbook around 45 years back, it is to train and retrain a person such that he attains the best possible level of physical ability so that he can lead his vocational life. Now, the aim of rehabilitation is not to enable a person to carry out the activities of daily living after a procedure. It is to enable him to live a socially and economically productive life. একটা মানুষকে খালি কাজ করতে পারলো সেই জায়গায় আমি এনে দিলাম সেইটা না, সে যাতে সোশ্যালি অ্যান্ড ইকোনমিক্যালি সে যাতে একটা সাস্টেনেবল তার নিজেকে সাস্টেন করবে, তার যা সোসাইটাল রোল, বিকজ এভরি ওয়ান অফ হাস হ্যাজ এ সোসাইটাল রোল. Some person is maybe the only wage earner of that family, and if we ground him, then the family suffers. And now there are several other domains too. It is not only confined to the physical domain. It encompasses the societal obligations, that means the social domain, the psychiatric well-being, especially in the cases of PTSD, the emotional well-being, especially after a procedure which I was asking the previous speaker, Professor Indrajit Saha, whom we miss in West Bengal Medical Education Service very dearly, and he was in our system, but we miss him now, and we would have been proud if we had him till now. Anyway, that's a different story. But as I was saying, that rehabilitation encompasses physical, mental, social, every domain. So the objective of rehabilitation is to give a comprehensive 360-degree care to the patient. One more problem, sir, which you all as doctors you encounter, is that we have lakhs and lakhs of Google doctors nowadays, especially the younger generation whom we refer as Generation Z, Gen Z, Gen Z, sorry, Gen Z. They, before they come to you for consultation, sir, be sure that they have consulted Google 1,000 times. They will be wondering why did you prescribe only ANA profile? Why you did not suggest PNK and CNK? Because they have got all those info through Google, though they do not know the individual implications of each. So you have now you also have to deal with the Google doctors and the doctors and the patients who come fully prepared with all their questions. And I wish the this conclave a great success, because after going through the program, I have seen that you have tried to encompass every possible domain which comes under the very concept of rehabilitation. And I wish this program is a total success. Thank you very much and have a nice Sunday.
Next, I'd like to invite on stage Professor Dr. Manos Bandopadhyay, Principal, Arjikor Medical College and Hospital, for a few words.
Respected DME sir, respected dignitaries on the dais and off the dais, the delegates, participants, and my friends, students, I wish you all a very good morning. I am very glad to be invited here today for Rehabcon 2025. I have just gone through the theme, comprehensive care beyond the conventional clinical care. The theme itself clarifies the need of such conference in the present time. As DME sir rightly said, that the concept of rehabilitation, physical medicine rehabilitation, is still not well known to every person. Gradually, as the chronic diseases continue to rise, the need of rehabilitation becomes the essential part of the healthcare services. We don't have much studies, but we know that some studies shows that there are 2 to 5% of disabilities in the population. So until we give a comprehensive patient care with both the therapeutic approaches, with the rehabilitative approaches simultaneously, the total healthcare service cannot be delivered or achieved. And we must emphasize on this. I reviewed the schedule of this program today. It is a day-long brainstorming schedule is awaiting for you. Many important topics will be discussed. I hope the participant will understand the essentiality of these rehabilitative approaches and also refresh their knowledge, and also to be sensitized with the different aspects of rehabilitations. And the main goal of a conference is not the being present here and the participating and the acquiring the knowledge, but one must take some message so that they can percolate the message to their patients and their neighbors and their friends. They will also know the newer development of this field, which will be applicable to their setup. One topic is there, the discussion on need for inclusion of subjects as an essential part of curriculum of MBBS students is there, and being a principal of one renowned medical institution of West Bengal, and along with my superior DME sir, we must understand the situation, and the discussion is the perfect and in a need for the hour, so that the students will be aware, the MBBS undergraduate students will be aware, as there is no such prefixed schedule for them for PMR. So they will be aware how the PMR is, what is the PMR is, how the rehabilitation is important for their future course of life. I don't extend my talk much before. I hope you all enjoy. I congratulate the organizers, and of course, I hope a grand success for this conference. Thank you all.
Thank you, sir, for your best wishes. I'd now like to invite Dr. Indrajit Sardar, sir, for a few kind words.
Thank you very much. Thank you once again for allowing me to come and to this conference, where I learned a lot of many things of which I didn't know before, and which I now will take back with me in my future, whatever practice I have. So the whole thing is this, that all these conferences highlight and illuminate the need for everyone to know of what is going on in the next room. While I was in PG hospital, I used to work in one department. I didn't know what was going on in the next room in the next department. And great things were going on, which we knew very little and only knew occasionally. Today is such an occurrence in which I am happy and glad to be here today to know a lot about another specialty in which so much things are being done to treat patients who are helpless. And that is the whole goal of doctors nowadays, to treat and help patients who are helpless and to treat their families who are sort of disappointed and distraught and try and get them back into a reasonable lifestyle. I think I'm glad that such occurrences, that conferences are happening, and I'm glad, and I am one of the great supporters that this should be a part of the undergraduate curriculum, which we'll discuss, of course, in better detail later on. Thank you.
Thank you, sir. Now we'll move on to the candle lighting ceremony for the inauguration. I'd like to request Dr. Shankar Prasad Sinha, sir, to felicitate our Honorable DME, sir. I'd like to invite Dr. Monomohan Biswas, sir, to felicitate Dr. Manoj Banerjee, Principal of Arjigor Medical College and Hospital. I request Dr. Mousumi Shen ma'am to felicitate Dr. Indrajit Sardar sir. I request Professor Dr. Shopon Mishra sir to felicitate Dr. Shankar Prasad Sinha sir. I request Professor Shamor Bishas sir to felicitate Dr. Monomohan Bishas sir. I request Dr. Dibyendu Das sir to felicitate Dr. Kaustubh Chakraborty sir. I request Dr. Amit Kumar Ghosh sir to felicitate Dr. Mousumi Shen ma'am. This brings us to the end of the inauguration session of Rehabcon 2025.